Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Acute and chronic shortness of breath. Shortness of breath is a common symptom that may come on rapidly or gradually. If you are experiencing shortness of breath, that does not mean you should necessarily be worried about lung cancer or serious conditions such as heart disease, but you should see your doctor as soon as you can. /r/n/r/n There are many causes of shortness of breath, and they are treatable. You will need to talk to your doctor, have a physical examination, and probably diagnostic tests to learn why you are short of breath. /r/n/r/n Most people describe this symptom as a subjective sensation of difficulty with breathing. You may have a feeling of being unable to get enough air in, or that it takes more effort than usual to breathe. Some people also describe a sensation of chest tightness. /r/n/r/n Shortness of breath can come on rapidly in a matter of minutes or hours, or it can wax and wane for days, weeks, months, or even years. /r/n/r/n Sometimes it can be hard to know how serious your shortness of breath is. In fact, sometimes the most severe shortness of breath can be something that's not life-threatening, like hyperventilation or a panic attack, and the mildest symptoms can be related to serious causes. /r/n/r/n Serious causes can be accompanied by other symptoms. /r/n/r/n Symptoms that suggest shortness of breath may be serious include :/r/n/r/n If you are trying to decide whether to call 911, it's best to get urgent help. /r/n/r/n Some of the causes of shortness of breath can be life-threatening and need immediate medical attention. /r/n/r/n You will see different terms used related to shortness of breath. A quick rundown of some of these terms include /r/n/r/n A normal respiratory rate in adults is considered to be between 12 and 20 breaths per minute at rest and varies with children depending on age. /r/n/r/n It's important to note that you may feel short of breath with a normal respiratory rate. The opposite is also true. You could have an abnormal respiratory rate without any difficulty breathing. /r/n/r/n In 85% of people, shortness of breath is due to a medical condition that affects the heart or the lungs. /r/n/r/n Some of the more common causes include /r/n/r/n Other common causes include /r/n/r/n Less common, but important, causes of shortness of breath may include /r/n/r/n Before dismissing shortness of breath as being due to inactivity, talk to your healthcare professional. /r/n/r/n It's important to make an appointment to see your healthcare professional if you develop shortness of breath, even if you think you might know the reason to explain your symptoms. They will take a careful history and do a physical exam. /r/n/r/n Some of the questions they may ask include /r/n/r/n The diagnostic tests you may need will depend on your particular symptoms and physical findings. /r/n/r/n Tests you might have include /r/n/r/n Other tests may include /r/n/r/n Dyspnea is very common with COPD. Your doctor may use themodified Medical Research Council Dyspnea scale to identify the severity of your dyspnea. /r/n/r/n The treatment of your shortness of breath will depend on the cause, but the most important first step is to make sure you are getting enough air to supply your tissues with the oxygen they need. This is referred to as the ABCs. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.